Today's topic is the mandibular nerve and the maxillary artery. So, mandibular nerve is one of the division of the trigeminal nerve, whereas maxillary artery is this green color indicates the maxillary artery. So, we are going to discuss two topics in this video. One is the mandibular nerve and second is the maxillary artery. So, first we will see about the mandibular nerve. So first, it is the largest branch of the trigeminal nerve. So trigeminal nerve is the fifth cranial nerve which has both sensory and motor functions. So normally it has two roots. Since it has both sensory and motor functions, it has motor root and the sensory root. So normally it arises from these two roots. Okay. So coming to the origin, where it starts, the mandibular nerve. Okay, so as I said, it has two roots. So sensory root, which arises from the trigeminal ganglion. So this trigeminal ganglion is usually presented in the middle cranial fossa. Coming to the motor root, it arises from the motor nucleus of the trigeminal nerve. Okay, so as you can see here, the green color is the ophthalmic, blue is the maxillary. So this red is the mandibular nerve. So these are the three branches of the trigeminal nerve. So we are more concerned and we are going to discuss more about the mandibular nerve. So coming to the branches of the mandibular nerve. So we have main branches which arises from the main trunk of the maxillary mandibular nerve. Okay, so coming to the divisions, it has posterior divisions and the anterior divisions. From the anterior divisions we have 4 branches. From the posterior divisions we have 3 branches. So overall branches you can see it here. So this is the branch from the main trunk, that is main branches, and this is the anterior division, and these 3 is the posterior division of the mandibular nerve. So first we will discuss about the main branches, that is meningeal branch and nerve to medial pterygoid. Okay. So this meningeal branches referred as the nervus spinosus. So this nervus spinosus which enters into the foramen spinosum. Okay. And coming to the medial pterygoid, nerve to medial pterygoid, it is the motor supply which supplies us the medial pterygoid and the two nerves, that is tensor tympani and tensor veli palatine. These two muscles are supplied by the nerve to medial pterygoid, and medial pterygoid muscles are also supplied by this medial pterygoid nerve. Okay, so coming to the anterior division, we have 4 branches: mesenteric nerve, deep temporal nerve, nerve to lateral pterygoid and buccal nerve. So here you can see this is the anterior division. So we have mesenteric nerve, deep temporal nerve, nerve to lateral pterygoid and buccal nerve. So all these 4 branches are the anterior divisions from the mandibular nerve. So this mesenteric nerve is a motor supply to the mesenteric muscle, whereas deep temporal nerve is also motor supply to the temporalis muscle. Deep temporal nerve supplies is the temporalis muscle. Nerve to lateral pterygoid muscle, motor supply. Whereas buccal nerve is the only sensory nerve in the anterior division of the mandibular nerve which supplies the skin over the cheek. So buccal nerve, as the name indicates buccal, it does not supply the buccinator muscle because buccinator muscle is supplied by the facial nerve. Okay. So coming to the posterior divisions, we have mainly 3 divisions. That is 3 branches in the posterior division. That is auriculotemporal nerve, lingual nerve and inferior alveolar nerve. So coming to the auriculotemporal nerve, it supplies us the sensory branches. It is the sensory function. It does the sensory function. Okay. So this auriculotemporal nerve gives the sensory to the auricular regions. Ear regions, temporal branches, that is temporal region. Okay. Parotid branches, it it acts as a secremotor function for the parotid gland, for the parasympathetic innervation of the parotid gland. Coming to the inguinal nerve, it is the sensory innervation of the anterior two-thirds of the tongue. So this lingual nerve, which carries the general sensation from the anterior two-thirds of the tongue. Coming to the chorda tympani is a branch of facial nerve, but it joins in the lingual nerve in the mandibular nerve. So coming to the inferior alveolar nerve, so this is the largest branch in the posterior division. So it supplies the sensory innervations for the teeth and the motor supply for the nerve to medial pterygoid. So this nerve to medial pterygoid, which supplies the two muscles. One is mylohyoid muscle and second is the anterior division of the anterior belly of the digastric muscle. So here you can see here. So this is the inferior alveolar nerve. Okay. So this inferior alveolar nerve gives rise to the nerve to mylohyoid. So this supplies the mylohyoid muscle and the anterior belly of the digastric muscle. Two muscles is supplied by the inferior alveolar nerve, which gives a nerve to mylohyoid. So, and the terminal branches of the alveolar nerve is the incisive branch and the mental nerve, which mainly supplies the floor of the mouth. Okay, so this is the terminal branches of the inferior alveolar nerve. So coming to the clinical aspect, first is the nerve block. So this nerve block is something we are going to give some medicine or anesthesia. So while giving this, the nerve signals from the nerve gets blocked and does not reach the brain. So this nerve block is usually done to anesthetize a particular area during some of the surgeries or the operations. So coming to the auriculotemporal nerve block, so this nerve is blocked during the to anesthetize the ear, temple and parotid gland areas. Okay. Coming to the inguinal and inferior alveolar nerve block, this is done during the dental surgeries or dental related some of the operations, so that this nerve, lingual nerve and the inferior alveolar nerve is blocked. So coming to the Fraze syndrome, in Fraze syndrome, auriculotemporal nerve, which is the sensory supply for the auricular region, temporal region and the secretomotor function of the parotid gland, is all done by the auriculotemporal nerve. So when this temporal nerve gets injured, there will be sweating in the sensory regions, which is supplied by the auriculotemporal nerve. So on these regions there will be sweating while eating. So there will be sweating will be taking place in these regions while eating. So in Fraze syndrome, another nerve is also just get injured, that is the great auricular nerve. Okay. So coming to the maxillary artery. So this so up to this we have seen about the mandibular nerve. So mandibular nerve branches and what are the supplies and what are the sensory functions, what are the motor functions, all we saw. So coming to the maxillary artery. So this maxillary artery is the terminal branch of the external carotid artery. External carotid artery. Okay. So this external carotid artery continues as the maxillary artery. Okay. So actually this maxillary artery is divided into three parts by the lateral pterygoid muscle. So this three parts is based on the location of the maxillary artery. Normally the first part is located in the mandibular region, second part pterygoid region and third part pterygopalatine region. So all these regions, the maxillary artery will be presented. So according to the regions, it is classified as the first part, second part and third part. It is divided. Normally this division is also taking place because of the lateral pterygoid muscle. Okay. Coming to the first part of the maxillary artery, we have 5 branches. we have 5 branches. What are the 5 branches? That is anterior tympanic artery, inferior alveolar artery, deep auricular artery, and accessory meningeal artery and middle meningeal artery. So normally all these 5 branches are the first part, just arises from the first part of the maxillary artery. So to remember, a mnemonic is there, AI dam. So AI dam. AI in the sense AI, artificial intelligence, but here we are going to use it the mnemonic as AI dam. AI in the sense A is deep tympanic artery, I inferior alveolar artery, D deep auricular artery, A accessory meningeal artery, and N middle meningeal artery. Okay, so this is the mnemonic. So to know more about this, so first deep anterior tympanic artery and deep auricular artery, which supplies us the tympanic membrane and the tympanic cavity, that is middle ear cavity. So all these are supplied by the anterior tympanic artery and the deep auricular artery. Coming to the inferior alveolar artery, which supplies us the mouth in the teeth regions. Okay. Coming to the meningeal artery, that is accessory and middle meningeal artery. So both supplies us the meninges present in the brain. Mainly dura mater is supplied by these 2 meningeal arteries. So these are all about the first part branches. In this sense, branches which arises from the first part of the maxillary artery. So coming to the second part branches, in this sense we have 4 branches in the second part of the maxillary artery, such as deep temporal artery, pterygoid artery, messenteric artery, buccal artery. So the second part of the maxillary artery is mainly involved in the mastification muscles. So messenteric artery, buccal artery, pterygoid artery, and deep temporal artery, not deep auricular, deep temporal artery, deep temporal artery. Okay, so first branch in the second part of the maxillary artery is deep temporal artery. So deep temporal artery, which is the first branch in the second part of the maxillary artery, and second branch messenteric artery, pterygoid artery, and buccal artery. Okay, to use the mnemonic, we have don't mess pterygoid branches, pterygoid bites. So I'll repeat it. So don't mess pterygoid bites. So as the second part is known as the pterygoid part, so just remember the mnemonic has the don't mess pterygoid bites. In the sense, D stands for deep temporal artery, M messenteric artery, P pterygoid arteries, and B buccal artery. Okay. So coming to the third part branches, we have actually 6 branches arising from the third part of the maxillary artery. That is posterior superior alveolar artery, infraorbital artery, pharyngeal artery, splenopalatine artery, artery to pterygoid canal, descending palatine artery. So all these are the branches of the third part of the maxillary artery. So this posterior superior alveolar artery, actually infraorbital artery, which passes through the infraorbital canal, and artery to pterygoid canal is also passing through the pterygoid canal. So splenopalatine artery, so this is the terminal branch of the maxillary artery. So this is how the maxillary artery gets terminated. As you know, the external carotid artery continues as the maxillary artery, and maxillary artery terminates as a splenopalatine artery. So this splenopalatine artery which supplies is the nasal septum mainly. Okay. So coming to the applied aspect, we have 2 applied aspects, that is epitaxis. Epitaxis in this sense, it is the nose bleeding, which is referred as the epitaxis. So this nose bleeding is usually taking place due to the damage of the splenopalatine artery, which involves in the little's area of the nose. Okay. Coming to the epidural hematoma, so when there is rupture in the middle meningeal artery which runs beneath the pterion, so this is main. So the beneath the arterion, the middle meningeal artery runs. So when it get injured or damaged, epidural hematoma will be taking place. That is, during the head injury, this artery can get damaged, so that it results in the epidural hematoma. So thank you.